that here talking about the type of advanced directives. But what is advanced directives? The type of advanced directives included living will or DPOA, means durable power of attorney, and DNR or AND. DNR stands for do not resuscitate, and AND means allowing the natural death. In these two cases, provider need to write an order, right? But I am saying before to go one by one, we must know what are the type of, now what are the advanced directives, right? Basically, advanced directives are the written instruction to recognized under the state of law that are related to the provision of care a person wishes to have when he or she cannot make the decision by themselves. What does it mean? Like a patient is very severely ill, going to die. If they thought they are going to die, in that case, who will take the decision on behalf of them? So they gave the permission. In absence of them, they can take the decision. So maybe the spouse or family member or even the friends, but they must be permitted by the person, right? Like few years ago, I want to share this example. So McCain, right? He suddenly diagnosed by the brain tumor. And before the condition going to worse, he gave the advance directive to the family. He's a popular person, so people are very curious about him. When he undergo the unconscious family and he under the life support, family came in the make the conference and they tell they want to remove the life support. And when they removed the life support, doctor removed and he passed away, right? So he gave the power of attorney or advanced directives before his condition. In some medical condition like psychiatry, mental health, they are not physically or mentally compatible for the decision make. So that times also the family can make the decision, but this is the different than the advanced directives, right? So the type of advanced directives, first one is a living will. So living wills means prepared by a competent adult and give the healthcare direction in case when the person is unable to make the decision on their own. So when they gave the order or permission, that times they are compatible, but in future they do not know. So they give the permission. So living will basically communicate with the patient wishes regarding the medical treatment if patient become incapacitated, right? And durable power of attorneys right? Durable power of attorneys means this is the documentation that specify who will make your healthcare decision if you cannot. So this is the documentation. Who will take care of the decision if you are not able to make the decision, right? So durable power of attorney, basically patient uh, designated healthcare proxy to make a medical decision for them if they become incapacitated. Another one is the called provider order. And you see some patient under the DNR, or they allow the natural death in the end stage of life. If you see the order, DNR or allow the natural death, right? So that times when you do not get the pulse or heartbeat or pupil is dilated, you will not start the CPR because patient under the do not resuscitate or they allow the natural death. So as I told you, the patient supposed to talk with the healthcare provider for the prescription because the provider need to order. So provider order or prescription for DNR or allow the natural death. So in these two special case, they must need the provider order or physician order need, right? So here last line, provider consultant with the client and family prior to administering a DNR or allow the natural death. And last topic from here, this is called the mandatory reporting to the RN. So when you give the treatment to your patient and some medical condition, we has to inform to the social worker, right? It's called mandatory reporting. So when you give the treatment, if you suspected any kind of abuse, so if I ask, or NCLEX book sometimes asks, who is most under the risk of abuse? Extremely old person or extremely young person? So if the person, patient or client is 82 years old and patient is Alzheimer, because Alzheimer is a forgetfulness, dementia is more common. So elderly patient with Alzheimer or dementia under the risk of abuse. If a 6 years old children scratch mark in their legs or a hand, you maybe think it is normal when they go to play with their friends, maybe they get fall and something happen. But if you get the scratch mark in their buttock, in their thigh or back of the shoulder, it's suspected abuse. Infant usually very unlike they get infected, I mean any suspected of abuse, but if they have any abnormal bruising or scratch mark or blood clot, it indicates abuse. So if we get any suspicion of abuse like child or elderly patient or domestic violence, we must inform to the social worker. And definitely we has to follow the facilities policies, right? Even the domestic violence. In that case, we has to talk to the client one-to-one in isolated room. And if patient need the shelter, if patient need any kind of support, we has to provide it. And also we has to talk to the social worker, right? And also when you work as an RN, if you get any communicable disease like STD or STI, sexual transmitted infection or sexual transmitted disease, or even airborne disease like tuberculosis, we have to inform to the department, right? Communicable disease to the local or state health department is called CDC, communicable disease control. So when we get any or suspected communicable disease, we should inform to the state. It is mandatory, right? So nurse must report communicable disease diagnosed to the local or state health department for a complete list of reportable disease and description of the reporting system. And so it is called Center of Disease Control and also Prevention. So in this website, we supposed to get them. So reporting following office, especially monitor for the common source of outbreak or plan to evaluate the control and prevention plan like immunization. So immunization or vaccination we give or do to prevent the communicable disease. So like airborne or other disease like flu, when you give the flu vaccine, you can stop the outbreak of the disease or you can stop the pandemic, right? And this is also the part of public health issues. So public health prioritization is most important here.